Well, let's return now to our main story this hour. GPs have been asked to be on standby from the start of next month to offer the new COVID vaccination if regulators say it's safe and effective. Well, Dr. Sarah Pitt is a virologist at the University of Brighton and a fellow of the Institute of Biomedical Science. Dr. Pitt, thanks very much for being with us on BBC News. I mean, we'll leave aside this great news that this vaccine has been identified. We'll hope that it passes those last regulatory stages. It then falls to you guys as GPs to actually effectively provide this in terms of the distribution, all of those. What sort of questions will you need? What sort of help and support will you need to get to that stage, do you think?
I'm sorry.
Oh, sorry. Forgive me. I'm mixing up. You're a virologist. As a virologist,
Yes.
Talk to me about the practicalities of this as a treatment. What do you make of it?
Well, I mean, it's a major feat of science because it was a relatively new type of technology that they used. So we always weren't sure that it was going to work, and it's amazing. It's really amazing that it has actually worked, and also that they picked the bit of the virus which we thought was the main target, and it looks as though that was right as well. So that's really good. But obviously, it has got to go through safety checks, and then obviously you've got to make quite a lot of doses of it. The vaccination schedule is going to be one dose and then another one 3 weeks later, and then it's not going to work for like another week until after that. So it's sort of a month before you're going to be protected. And so what it means is it's another tool in the box of all the tools that we've got to try and combat COVID. So it will go alongside social distancing, which I think, and mask wearing where people can, which I think is going to have to go on for a little bit longer, and obviously testing as well. But if some people can have the vaccine and they can, that will stop the transmission of the virus from some people. Testing and then identifying people who have the disease and isolating those will stop transmission of the virus from those people, and then mask wearing and social distancing will help transmission of the virus from everybody else. And so it should help.
So in a sense, the vaccine, and lots of people have said this over the last 24, 36 hours, is not a magic bullet in itself, but it triggers other changes which, as a consequence of those taken all together, will gradually reduce the virus's ability to kind of reproduce itself, jump from one person, infect multiple people and so on.
That's right, and that's what we're really looking at. And the other thing to bear in mind is that you need 2 doses of the vaccine. And if you're going to vaccinate everybody in the world, that's 2 doses of vaccine for everybody. That's a lot of vaccine. So it's not going to be ready for everybody by, even by early next year. But if some people can have it, particularly perhaps the people who are most vulnerable, the people who are the front line of healthcare and other sorts of jobs where they're coming into contact with a lot of people, if those people can have it, and even if only some of them are protected, that will really help. But it's not the answer all by itself, but it's a really, really important breakthrough, I think, overall. Just one last point then on that. From the point of view of everybody else who doesn't get the vaccine, and most of us won't be anytime soon, even if it were to be available early next year, it's going to be particularly the most vulnerable, elderly, and people who are working in the health service and working care. That will make sense. Yes. But for everybody else, that means that certain things that we have found frustrating, but we just have to accept them, maybe for up to a year more. I'm afraid so. I know we all want this to go away. I want to be able to hug my mother, but I think it's going to be a little bit longer before that's actually going to be possible, I'm afraid. But it does look to me, feels like the light at the end of the tunnel, and you could sort of see where we might be going. I'd say maybe by this time next year is what we might have. We might have got rid of the virus altogether. That's what I really believe. We can get rid of SARS-CoV-2. We got rid of SARS-1, and I'm really hoping that this might add to our chances of actually doing that.
Yeah, and we did it with SARS-1 without a vaccine. So if we got a vaccine, we're a lot further forward.
Absolutely.
Dr. Sarah Pitt, thank you very much.
Thank you.
Dr. Pitt's mum, just hold out. It'll be a little bit longer, but she's going to give you a hug eventually.